Today we're going to talk about heat injury. Heat injury is most common during exhaustive exercises in hot, humid environments and is worse when the athlete is dehydrated. Heat injuries not only affect the less well-trained, but can have an impact on highly trained individuals as well. It's defined as your body's inability to continue to exercise in the heat. Heat-related pathologies contribute to a significant amount of athlete illness and is the third leading cause of death in the U.S. of high school athletes. Risk factors for heat illness are dehydration, hot and humid climates, obesity, low physical fitness status of the athletes, a lack of acclimatization of the athlete to the environment, a previous history of heat stroke, sleep deprivation, some medications can cause problems with heat illness, and some upper respiratory and some gastrointestinal illnesses can be a problem as well. Dehydration with a fluid loss as high as 6 to 10% appears to be the most common risk factor of those suffering from heat illness. During the early stages of exercise in hot environments, sweating begins and the skin blood vessels dilate, causing increased heat loss. As central blood volume and pressures fall, the body's nervous system will cause the skin blood vessels to constrict. This is the point where the risk of heat illness increases. Dehydration increases the risk of heat exhaustion and is a risk factor for heat stroke. Heat stroke is associated with other factors as a lack of acclimatization, medication, genetic predisposition, and illness. Heat exhaustion is the most common form of heat illness. It's considered a volume depletion problem and primarily occurs when cardiac output is reduced, resulting in the inability of the cardiovascular system to meet the demands of both exercising and peripheral cooling. Symptoms include nausea, vomiting, irritability, headache, anxiety, diarrhea, and chills. Heat illness of any kind, exhaustion or stroke, means the termination of exercise at that time and focus on the treatment of the athlete. Since heat exhaustion is a water volume issue resulting in cardiovascular compensation, simple rehydration often results in complete recovery in as little as 15 to 30 minutes. In most cases, fluids can be replaced orally. However, in some severe cases of heat exhaustion in which the subject may be unconscious or lacking mental acuity, IV solutions may be necessary. Heat stroke can be a life-threatening event, and if you experience an athlete with exertional heat stroke, you should contact medical support immediately. The key difference between heat exhaustion and heat stroke is that the body is spontaneously cooling in heat exhaustion. With heat stroke, the body has stopped the cooling process and is accumulating heat. The skin will be hot and dry. Other characteristics of heat stroke is bizarre behavior exhibited by the athlete. A person with exertional heat stroke may be disoriented with a complete loss of mental acuity, or in most severe cases may be comatose. Again, it's important to remember that heat stroke is a life-threatening situation. You should call 911 immediately and make every effort to cool the individual. So, when preparing to exercise in the heat, determine the heat stress index and make appropriate adjustments to your workout. Know the signs and symptoms of heat illness. Wear lightweight, loose-fitting clothing. Exercise at cooler parts of the day, avoiding long warm-ups on humid days, and ensure proper hydration before, during, and after practice.